In this video, I will address common questions about strengthening your pelvic floor muscles and provide valuable insights on how to effectively engage these muscles for optimal health. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. This is video 1 of my free 7-part journey series about Revive Pelvic Floor Health Core Rehab, where we utilize core back immersion therapy. And this is a very important topic because there's a lot of women out there who goes to the doctor after they gave birth, or for those perimenopausal, menopausal women where they're having symptoms of latchkey, weak bladder, or they have diastasis recti and they don't know how to begin to strengthen their core safely and effectively postpartum. And that's why I'm here to share as much education knowledge to start and begin the journey of a gentle core engagement. If you have C-section, diastasis recti, umbilical hernia, or pelvic floor prolapse, where your pelvic floor has a lot of pressure downward after 9 months since you got pregnant, and after delivery, it got some weakness that happened for 9 months of deconditioning. And I'm here to guide you on a journey to a stronger and healthier pelvic floor. Throughout my years of practice, I have assisted over 10,000 individuals avoiding surgeries for their hernia, diastasis recti, or back pain. And it's amazing how simple core effective workouts without any high impact, especially for absolute beginners, to slowly progress to improving their back strength, mobility, posture, and confidence. And that will help your pelvic floor when you have an overall improvability strength, especially if you're breastfeeding your child and you have lean forward posture, or the heaviness of your breast tissues that presses down to your pelvic floor and you need that strength back, or if your lifestyle is a lot of sitting that causes this hunch forward head round the shoulder posture or text neck. So in this video, I will delve into the importance of your pelvic floor muscles and core, shedding light on how these areas impact not only women but also men. So I have some students also online and even in the clinic with pelvic floor issues. If they have prostatectomy or those prostate cancer, and the removal of the prostate causes this a lot of muscle imbalance, bladder incontinence, they can't fully empty, that results to never-ending cycle of going to the restroom a lot to pee, or they have to wear diapers, and unfortunately it's not quality of life. We need to address this weakness from your abdominal muscles, your internal, external obliques, your back, diaphragm, and pelvic floor. How to connect mind-body awareness once you start disconnected from these areas, especially your gluteal muscles. This will help support not just your spine, but your pelvic floor. And if you have tight hips, because our pelvic floor muscles underneath us is like a basin, and those hip internal, external muscles go in around webbing inside our pelvic floor. While Kegel exercises are often recommended by most doctors, just do Kegel, here's the pamphlet, here's some videos you can watch to strengthen the pelvic floor, it is essential to recognize that they are not the only solution. And the problem is when you just tighten and contract without relaxation, that's when the problem starts. Because too much contraction causes stiffness and tightness and stress incontinence, urge incontinence. When you're so tight, you need to learn how to relax to fully empty the bladder. So this is the root of the weakness or muscle imbalances. So we will discuss the weaknesses in the lumbopelvic hip complex can lead to strain on your pelvic floor. So the lumbopelvic hip complex is called the core. So it's not just the abdominal muscles, it's the complex from your diaphragm, pelvic floor, hips, and back. So by incorporating core strengthening exercises alongside with Kegel, with mind-body awareness and breath work. So I usually start with a lot of breath. When you take a deep breath through your nose, expand up your abdominal muscles and zip it up from your lower abs to your navel. That will give you a comprehensive recovery and long-lasting results. So I will also share tips on how to prevent back injuries while strengthening your core, highlighting the importance of listening to your body, listening to your abdominal muscles. If there's any doming or the diastasis recti is pushing out or coning when you exert effort. So you want to make sure you listen to your body more, recognizing the warning signs of discomfort. So by exercising mindfully and paying your attention to your body's cues. So you know what's best for you, but make sure you listen as well. I don't believe in no pain, no gain. I believe when there's pain, you stop and there's always the next day. So you can avoid potential injuries and setbacks in your recovery, especially for postpartum women. So if you experience challenges with bladder control, pain, and weakness in your pelvic floor, this video is designed to provide you with the actionable steps to improve your pelvic floor health and overall well-being. By implementing the techniques and exercises, we have to start the absolute beginning program. So in this video, I will discuss you how to take the proactive steps towards a stronger core, improve posture that will help your pelvic floor. The strength of your feet, your midfoot will also help from ground up to your pelvic floor. So there's so many variables to have a healthy pelvic floor. I'm not talking a lot. I will need to discuss this because before you proceed to any exercise program, you need to understand your body. That's why video 1, I have to really talk about it before we start with foam roller, wall Pilates, ball, and anything that inside my 8-week Revive Pelvic Floor Health Core Rehab, where I'm going to reopen very soon. So in this video, I will guide you through a crucial step in properly engaging your core and pelvic floor muscles, the art of breathing, the breath work. So understanding how to breathe effectively while in a seated position is fundamental for activating your diaphragm and optimal promoting engagement of your pelvic floor. So I'm really touching my abdominal muscles, and you can also do this lying down, one hand on your back, one hand on your stomach. So when you're lying down, there should be a gentle space at the low of your back, a neutral spine where you can glide your hand at the small of your back. By learning to breathe in through the nose, expanding the rib cage laterally, not this way, not scrunching your neck, but laterally and gently expanding the abdominal muscles, you can create the space in the pelvic floor, allowing the organs such as the reproductive system and digestive organs to be lifted and reducing pressure on the pelvic floor. So as you inhale, your diaphragm goes down, your pelvic floor goes down, but as you exhale, zip it up from your lower abs. Imagine if there's a zipper, you don't want to touch your skin when it's tight, Jean, and you want to scoop it up as you breathe out through your mouth. Imagine these breathing techniques as a piston-like motion, with your diaphragm moving in a dancing motion up and down with each breath. By incorporating gentle tightening of your glutes and abdominal muscles, when you tighten them, there's EMG studies that you also help. There's a delayed reaction on your pelvic floor, but it helps, especially if you really can't connect. I believe in connecting by squeezing your glutes and squeezing on your abdominal muscles can further activate the weak, deconditioned, and tight pelvic floor muscles. And I remember when we were studying in school, they said, don't squeeze your glutes, don't squeeze your abdominal muscles. But the problem is when you don't do that, they had difficulty engaging. So I said, this is an intentional focus on breathing and core engagement. I believe you have to do that to make better results because it's hard to isolate it when there's so much deconditioning happen. And the significant improvements in pelvic floor strength and function is incorporated with this gentle movements, even those areas. So as you practice this breathing technique, visualize the pelvic floor muscles working in harmony with the diaphragm, creating a supportive and stable foundation of your body. So my recommendation is to 10 deep breaths like that. Inhale, don't lift your shoulders, don't tighten your neck, and then zip it up. Slowly squeeze your glutes, squeeze your lower abs, zipping it up to your navel and keeping your back straight. By mastering the art of breathing in a seated position and incorporating these mindful techniques into your daily routine, you can transform how your core and pelvic floor function. This holistic approach to pelvic floor health and alleviate the downward pressure that improve the muscle tone and enhance overall well-being. Usually with my patients in the clinic as well, I recommended a lot of breath work throughout the breath work, plus doing their exercises where I'm going to encourage you to start right now. And also we're going to do some pelvic clocks where we're going to place like there's a clockwork on our abdomen from the quadrants of our abdominal muscles. So I encourage you to follow along with the breathing exercises demonstrated in this video, paying close attention to the expansion of the rib cage, so you can place your hands on the side of your ribs, and the gentle tightening of the glutes and abdominal muscles with the zipping it up motion, as I said, and the dancing motion of the diaphragm as it goes up and down together with your pelvic floor. Through consistent practice and mindfulness, you can unlock the full potential of your core and pelvic floor. And my recommendation, as I said, you can do this lying down as well. Abdomen, hand at the small of the back, bend your knees to slightly give space at the small of the back, not the whole forearm, but just the hand as you embark on this journey towards improved pelvic floor health. If you can lie on your back, you can keep your head a little bit elevated with a pillow. Remember that each breath is an opportunity to strengthen your body from the inside out by prioritizing the proper breathing techniques and core engagement. You can cultivate a strong, resilient foundation that supports your overall well-being. So that's why I invite you to join right now. So we want to make sure you place your hand. As I take a deep breath, you can see my abdominal muscles rising, right? And my lateral rib cage to the side. And then as I zip it up, lower abs to my navel, keeping my spine in neutral position. And you're going to feel that tightening here, especially if you have C-section. It's going to be a little bit tender and tight. And if you have doming, you know if you have doming, when you lift your head up and lift your shoulders up, you're going to see a cone in the middle. And you don't want that. That's why keep your head down. It's my best recommendation. And after doing those simple breath work, now it's time to do the pelvic lock. So if this is 12 o'clock at the base of your, on the top base of your rib cage, where your xiphoid processes on your underneath your breastbone, and then 6 o'clock is in your below your near your pubic suprapubic area. So this is when you're gonna do a little bit tilting, but try your best not to press too hard. Keep that neutral spine as you press the 12 o'clock and 6. Just gentle, not too much to the point you're really tilting like this. I don't like this. You don't want to spill the coffee beans. If there's a coffee in the middle, you just want to be mindful by placing your hand on your abdomen. So 12 o'clock, tighten. This is going to be very difficult to connect, but that's so important to be patient. So as you inhale, you expand your belly and you start zipping up from the 12 o'clock. And you take a deep breath again. And then you press on your 6 o'clock. Zip it up to your navel. Again, most of my patients, when they zip it up, they have downward pressure. They go from the top and down, and I don't want that. So expand. This is the master of breath work, and it's very difficult. I know it takes time for mind-body awareness, and it will get better as you practice. So I'm here to encourage you, it will get better. And zip it up. Inhale, expand. 12 o'clock. Start at 12. And after doing 12 and 6, that's when you can do the clockwork from 9 to 3. Inhale, and then 9 o'clock. Inhale, and then 3 o'clock. I'm pressing it to give that cueing, the tactile cues on your abdomen. Inhale, 5 o'clock. Inhale, 7 o'clock. So I'm doing a diagonal movement as well. Inhale, a little bit off to the side, 11 o'clock. Inhale, as you breathe out, 1 o'clock. And then you can do the clockwork from 12. Inhale, exhale, 12. Inhale, and then 1. As you go through along the clockwork. And do that 1 round. And once you reach back to 12, you go from 12 to 11. Inhale, 10. You go all around back. So that's how you master your breath work. Practice every single day. If you can do twice a day, that would be great. So that's video 1. I know it looks boring, but I want you to incorporate this first before we go to video 2. So stay tuned for more guidance and practical tips on revitalizing your pelvic floor, your abdominal muscles, and enhancing your core strength safely and effectively. Because if you don't practice this well, it's a little bit more confusing with movement patterns with our lower body, upper body. It's like a dance move where you're going to slowly engage everything together. We can empower your breath, your move, and thrive with confidence and vitality. Thank you for joining me on this transformative journey. I know it's only day 1 of our free 7 journey series, and And it's okay to take a deep breath, engage your core, and embrace the power of mindful breathing for a healthier, stronger pelvic floor. I know it's your first day only. There's so much more to come. You might even feel sore in the first breath work. 5 to 10 minutes every day, you can see amazing results already, because in the next few days, I'll release video too. So if you're serious about regaining a stronger pelvic floor, bladder, core, improving posture, and relieving back pain from postpartum or from sedentary lifestyle, I have exciting news. In a few days, I'll be launching my Revive Pelvic Floor Health Program. I'll be taking a limited number of students, so make sure you write down your name and email address down below, because I'll be teaching how to achieve all these goals, find the solutions for good, so you can embark on a healthier pelvic floor and overall core health. So spots are granted for a first come, first serve basis. So make sure you click the link down below, write your name and email address. Join the early bird waitlist as I'll reopen it on October 1st, so don't miss out. Those on the waitlist will have access to the registration link before the program launches to the public. So look out for that announcement, where I'm going to give you the go-ahead signal through my email, and you receive a text from me if you write your phone number. So thank you for watching, and I look forward to helping you on your journey to your pelvic floor and overall wellness. So make sure to tune out on video 2, where I'm going to incorporate more movement patterns. And I know you're excited for the foam roller, and this is gravity assisted. This is something I'm going to show you how it's so beautiful. It helps a lot of my patients with bladder incontinence when you tip your bladder back, and there's less downward pressure when you elevate against gravity. So stay tuned for more valuable insights and guidance in our upcoming 7 free journeys video series. So take care and be well. I'll see you in my next video training. So don't forget, if you have more time today, watch the difference about umbilical hernia and diastasis recti over here, and watch this video about printing technique. Until my next video training, always remember, be safe, be well, and healthy you. Bye!